Sandy Jo Malman lived with the pain of an arthritic knee for 12 years. She wore a brace and walked with a cane. Even her career as a cellist was impacted.
When I would get up from playing, my knee would stay in the position of sitting. It wouldn't straighten out until maybe 45 seconds later.
She went to Dr. Jeff Zarin in the Department of Orthopedics at Tufts Medical Center and was their first patient approved for robotic-assisted knee replacement surgery. The Mako machine takes up about the space of a person in the operating room. Dr. Zarin uses the same implants he always did, but now he can place them much more precisely.
It's almost like having X-ray vision for me.
The advantage is the specific prep work the technology allows. A CT scan creates this 3D model. Zarin can check alignment and correct imbalances down to the millimeter, all before surgery.
Measure how tight their ligaments are and how crooked their leg is, and then I can make adjustments to the leg and the tension in the system.
Once he's decided on his plan, Zarin and Mako's robotic arm get to work. Zarin guides it as he checks the screen. You can see the blue rectangle. That's the instrument used to remove the portion of bone highlighted in green. Notice the thin green lines outside the leg, boundaries Mako will not let him cross.
It doesn't let me make a mistake in terms of getting out of plane. So if I try to put the cutting tool in a bad place or out of alignment, even by a degree or a millimeter, it will stop me.
And that kind of precision is what Zarin says could mean better outcomes for patients like Sandy. Her surgery went very smoothly, and she's on the road to recovery, hoping to play her cello again soon.
Dr. Zarin has 50 more Mako-assisted knee surgeries scheduled for the rest of the year, and he says anecdotally that technology appears to mean better outcomes for patients, but they do need more hard data to confirm that, so he's now working on a research grant to study those results.
It's fascinating.
Really interesting, right? And it could be, I mean, you know, he's so passionate about it, but it could be the future of surgery,
right?
You know?
And maybe, you know, it would also reduce some of the costs involved too, eventually.
Potentially, yeah. There's a lot of implications here, so it's pretty exciting.
Okay.